Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the NARM Training Institute. I'm your host, Emily Ruth, and I'm so glad you've joined us today. Hi, Transforming Trauma listeners. Do you want to join the international NARM community in support of trauma-informed care? If so, please consider joining us to become trained in the neuroaffective relational model. We are excited to offer 2 starting levels of professional trainings designed to support those of you working with clients or populations dealing with the effects of adverse childhood experiences and complex trauma. The Level 1 Online NARM Basics training is a psychoeducational training designed for helping professionals in a variety of fields, such as mental health professionals, substance abuse counselors, educators, doctors, nurses, other healthcare providers, coaches, and more. The Level 2 NARM Therapist training is a comprehensive clinical training designed for licensed mental health professionals, as well as current mental health graduate students and clinical interns and trainees. For more information on these NARM trainings and to apply, please visit www.narmtraining.com/schedule. Dr. Judith Lewis Herman is a psychiatrist, researcher, teacher, and author who has centered her work on the study of traumatic stress. She developed the diagnosis of complex PTSD when she found that victims of prolonged or multiple traumas frequently develop symptoms that are significantly different from those associated with traditional PTSD. Dr. Herman is a professor of psychiatry at Harvard Medical School, as well as the director of training at the Victims of Violence program in the Department of Psychiatry at the Cambridge Health Alliance. Dr. Herman has received a Lifetime Achievement Award from the International Society for Traumatic Stress Studies and was also named a Distinguished Fellow of the American Psychiatric Association. Dr. Herman is the author of the award-winning books Father-Daughter Incest and her seminal work, Trauma and Recovery. Her third and most recent book, Truth and Repair: How Trauma Survivors Envision Justice, was published in March of 2023. She is an advocate for victims of traumatic crimes, and her contributions to the field of trauma cannot be overstated. I hope you enjoyed this conversation with Dr. Judith Herman. All right, I'm sitting here with Dr. Judith Herman, and I'm really looking forward to this conversation today. Welcome to Transforming Trauma.
Thank you for having me.
Absolutely. I'm a huge fan of your work, and I would dare say that most folks listening to this conversation are going to be familiar with your books. Of course, your first book, Father-Daughter Incest, and then Trauma Recovery, where you so eloquently distinguish between single event trauma and chronic or developmental trauma. And the field has been so impacted by your contributions. So I just want to say thank you, not only as a clinician, but as a human, as a woman, as a survivor. I really deeply appreciate your books. And I'm so excited to talk about your newest and very important book, Truth and Repair, that just came out in March. Is that right?
That's right.
Yeah. And I read it just a few months back, and there's just so much richness. And I'm really excited to dig into that. I'd love to start how we usually do on this podcast, and that is to ask, what would you like listeners to get out of our conversation today?
When I wrote Trauma and Recovery, I argued that trauma is not just an individual problem, it's a social problem. And that's really the take-home message of this follow-up book, Truth and Repair. If trauma results from a crime, from an injustice, then recovery can't just be a personal, individual matter, because it leaves out the question of justice. So the new book, Truth and Repair, is really about justice and what justice would mean if anybody ever bothered to ask survivors what they wanted, which apparently nobody bothers to do. So I interviewed 30 survivors, 26 women and 4 men who were survivors of various forms of gender violence, sexual assault, childhood abuse, domestic violence, sexual harassment, sex trafficking. And I asked them, if you could write the script, if you had the power to determine what a just resolution of this crime would be, what would it be? And this book is about what they answered. And my argument is that I talked about gender violence because that's what I know best. And that's also, in terms of the United Nations estimates, probably the most prevalent human rights violation in the world. But I think the same analysis could really apply to any situation where dominance and subordination are deeply ingrained in a society, whether that dominance is based on race or class or caste or religion or you name it. And because dominance ultimately is always maintained by violence.
So I think I'd also love, before we dive in more into your book, because like I said, there's so much there. There's so many layers. I wonder if you could tell us a little bit, summarize a little bit of what your work in the field of trauma really before, for anyone not familiar, right? Like I said, I think most folks will be familiar with your work, but if you wouldn't mind.
I started out as a resident in psychiatry in 1970. And shortly before I began my training, I joined a consciousness raising group, that was the women's liberation movement, and that really set the course of my whole career. And I belonged to a group that was all white, highly educated women, very privileged. But even in that demographic, there were lots of stories about gender violence. And the woman who coined the term consciousness raising, Kathy Matnick, who was a classmate of mine and a friend, and had changed her name to Sarah Child when she became a feminist organizer because she wanted to be known through the maternal line. She had been a civil rights worker in Mississippi during Freedom Summer, and she had worked in freedom schools where people were brought together to talk about their lives and the truth about their lives. And she saw how powerful that was as an organizing method. And she named consciousness raising not only as an organizing tool, but also as a method of scientific inquiry. She said, nobody knows the truth about women's lives because women don't dare speak up about it. So it was with that awareness, this new awareness, that the subordination of women was maintained by force, that I approached my residency. And guess what? My first two patients on the inpatient service where I began my training were women who had made very serious suicide attempts. And what do you know? Both of them told me they had been sexually abused by their fathers and that they never dared tell anyone. And it wasn't really hard to make a connection between their wish to kill themselves and their early initiation into the life of a sexual slave. And what do you know? When you actually listen to them with compassion and didn't dismiss them and say, oh, did you know that, little girls fantasize about this sort of thing because it's what they really, really want? They got better. So that kind of set the course for my first book. After I finished my residency, I went to work in a women's free storefront clinic, and I saw more people with incest histories. And a colleague, Lisa Hershman, and I decided, well, we'll write this up. And we wrote it up for a women's studies journal. I don't think any psychiatry journal would have published it back then. The comprehensive textbook of psychiatry at that time estimated the prevalence of incest at 1 case per million.
They were just a little off. Just
yeah.
a few.
A few orders of magnitude. But I mean, that was the book learning. And that's why consciousness raising really was a method of scientific inquiry. So that's what led to the first book. And then that kind of set the course.
Yeah. So in Truth and Repair, and you already mentioned this kind of fourth stage of recovery as justice. Could you speak just a little bit to the first three, from your second book?
Sure. Just to kind of describe the evolution a little bit more, I went kind of on the strength of that first book. I think I was invited to join the faculty at Cambridge Hospital, which was a public sector Harvard teaching hospital that was at the time very much a sort of innovative place where people were interested in community psychiatry and making serious contributions to the field. And that's where Mary Harvey and I started the Victims of Violence program, really based on the fact that we were seeing so many trauma survivors as patients. And during the 1980s, I also formed a study group or joined a study group that had been organized by my friend and colleague, Bessel van der Kolk. He'd been working with combat veterans at the VA, and he invited people who were working with trauma in all different respects to join this study group. So we had people who were working at rape crisis centers and battered women's shelters and with combat veterans and with burn victims and abused kids. And what I kind of drew from that study group was the idea that trauma is trauma, whether you're talking about battered women or whether you're talking about prisoners of war. And the symptoms are the same and the recovery pathway is the same, whether you're talking about the so-called public political sphere of war and mass violence, or whether you're talking about the so-called private sphere of family and sex and childcare. And so I trace the course of recovery in 3 stages. Not that this is a prescription for a sort of a frog march, but rather as a sort of an attempt at describing the central focus of treatment as recovery evolves, where the first stage would be safety. And that's whether you're talking about refugees or whether you're talking about abused kids. If you're not safe in the present, you have no safe base from which to process what happened in the past. So the task of the first stage of recovery is always establishing safety. And that, of course, is a social task. It's not just, nobody can be safe alone. So it means, if you're working with battered women, you have to understand how to help them get housing and a restraining order and child support and food.
Right.
And similarly, if you're working with refugees or combat vets, safety is the first task. And then once you have a kind of a reasonable defensive perimeter from which people can go back into making sense of the past, then you move more into the stage 2, what some people call exposure or trauma processing, where people talk about what happened to them as a way of integrating the trauma into a narrative, a life narrative, where the trauma is part of this life story, but it doesn't totally define the person. And grieving the losses of trauma and making meaning of the trauma. And that, people fear that that's going to go on forever. A lot of people say, I'll just start crying and I'll never stop, right? But in fact, it does come to an end. And then people feel freer to refocus on the present and the future in a more expansive way. When you're traumatized, you can't think about anything but just being on alert for danger. And so you can't take initiative, you can't plan a future, you can't take risks. But in the third stage of recovery, people can broaden their horizons. And then that's when some people develop what my friend and colleague Robert J. Lifton calls a survivor mission, where, he described this originally with survivors of the Hiroshima atomic bombing, where the people who saw their city obliterated and survived questioned, why did I live when so many people died? And made meaning of that by saying, I live to tell the world and to try to prevent this from ever happening again. And so those were kind of the people I interviewed for the new book.
Mm-hmm. So you said safety and agency has to be established. Then survivors do that processing stage. And
Right.
then the third is beginning to grow and kind of re-engage with the community. So
Right.
that's where you started in this new book. You're
Right.
contemplating this fourth stage. And so share with us what first after a gap of time, it's been a few years since
Well, yes, it's 30 years since trauma and recovery.
first came out.
I started work on this about 20 years ago, and I did most of the interviews during a fellowship year at Radcliffe Institute for Advanced Studies. And then life, there were my own illness, my husband's illness. We moved to assisted living, my husband's death, and I became a grandmother. I mean,
Yeah.
I was getting older.
Yeah. You're yeah.
And life intervened. So this was
Mhm.
kind of on the back shelf until COVID.
Mm.
And during the height of COVID at my assisted living, since as we old folks are a petri dish,
Mm.
we were pretty much in solitary confinement. The dining room was closed. We had no visitors. We had no activities. We were allowed to go for walks outside, but that was it. Otherwise, we were in our rooms.
Wow.
And so I figured, well, can't waste a good pandemic. No.
Never let a pandemic go to waste.
Yeah.
Wow. So you were in your room and you had already started the book and you had contemplated.
I'd done most of the groundwork. I did a few interviews, and I actually went back and re-interviewed 3 people who I'd interviewed 20 years before
Wow.
to see how their views had changed. And that was very interesting. And then it was just a matter of writing it up.
And so it was just a matter of writing it up. And so what you had already done all this groundwork for it.
Mhm, mhm.
And how did you, I don't know, there's probably too many questions in my head, but I would love to just hear from you, what feels the most important? Because I imagine that in that 30-year gap, there were things maybe as you had been contemplating it, things had maybe shifted. And even just culturally, so many things have happened with the Me Too movement and other things that you mentioned in the book. So yeah, I'd love to just hear about that process, what that was like for you.
Well, I think in some ways what was more important was what hadn't changed. And that was that every survivor I interviewed, and in fact, this really applied to every patient I'd seen too over all those years. So by now it's, I just had my 55th medical school reunion. So it's been a while. They wanted truth and repair. They wanted acknowledgement as the most basic beginning of justice. They wanted the truth to be known. And it was more important for them to get acknowledgement from the bystanders than from the perpetrators. I mean, sometimes they wanted the perpetrators to confess if that was the only way that anybody was going to believe them. But really, what they wanted was for the bystanders to step up, to acknowledge the facts, to acknowledge the harm. So it wasn't just, because that's always the backup defense for the perpetrators. Okay, so it did happen. So what? Why are you still whining about this? So acknowledging the facts, acknowledging the harm, and then placing the blame where it belonged. They wanted the shame, the burden of shame taken off their shoulders and placed on the shoulders of the perpetrator. They wanted the bystanders to denounce the crime and say, this was wrong. This never should have happened. This was not your fault. And we support you. And not to make, to collude with or make excuses for, or not to give the perpetrator a pass, which is what so often happens.
Right. This is so important. I've heard one survivor in particular who said they were told years later, well, it must not have been that bad, or you would have tracked them down and prosecuted them and done something. And
Good luck with
survivors
that.
like that. And you named it so beautifully in the book that's not what survivors generally, we're not looking to have them slammed in jail. I mean, of course, if that protects other people,
Mhm.
yes. but that's not what is being, sought. And you just named that so beautifully. It was so validating.
Mhm.
And listeners can't hear, but your response when I told that story about what the survivor was told, it's
Mhm.
mind blowing. It's mind blowing.
Yes. No, and it's such a vicious stereotype about survivors that you can't ask them what they want because they're just going to be so vengeful,
Right.
and they're just going to want to have him shot at dawn. But in fact, when I asked survivors, and when I did my interviews, because of that stereotype, I asked specifically about punishment and revenge. And people were very ambivalent about punishment. And they were ambivalent about their own revenge fantasies.
Mm-hmm.
I mean, they all had them, but many people reacted to their revenge fantasies as though they were sort of like a foreign body, that they were sort of a residue of the hatred of the perpetrator. And I remember one woman who told me she had these dreams in which a dinosaur came and stomped on her rapist. And in the dream, she was joyful. And she would wake up and she would go, ugh, she would feel disgusted.
Yeah.
Because she said, that's not me.
Yeah.
And one of the nice things that happens in trauma processing groups, by the way, especially stage 2 groups where people do get into talking about things like revenge fantasies, is people can share they're very ashamed of their revenge fantasies, and they start to share them. And in the end, people find them funny.
Yeah.
Because, let's top this off. We don't want to just kneecap him. We want a truck to be coming down the road. And then, and then they've got tears running down their faces from laughter because they're detoxifying their revenge fantasies by realizing they're just fantasies, and they're just make them sillier and sillier and more excessive and extreme. And then, so they get distance from them. But no, people were not into revenge, and a lot of people were not into punishment. People would say things like, well, I don't even believe in prisons.
Right.
But on the other hand, there were 6 out of my 30 that actually went through the whole ordeal of a criminal trial, testified as witnesses, and in a trial that resulted in a conviction and a prison sentence. And they said things like, well, I had to do it because I knew he was going to do this to somebody else. And the detective told me he'd done this to lots of other girls and nobody ever dared to press charges. And I just couldn't live with myself if I found out that because I was too chicken to come forward, then he went and did it again. And this was somebody, by the way, I mean, it was a very wealthy suburb, a boy from her high school. And the boy's dad called up her dad and said, can't we work this out? How much do you want? I mean, so she said, no, I've got to go through with it.
And it's a painful process. It's not.
It's it's a hostile adversarial process, court of law. If you wanted to, I wrote this in the book, if you wanted to design a laboratory for making post-traumatic stress symptoms worse, the court of law would work perfectly. I mean, hostile interrogation and having to confront your perpetrator and being shamed and blamed in front of the whole public. I mean, and 20% of my sample went through that. I mean, in reality, most survivors never report to police. And then for rape, maybe 20%. And then you start from there. And if you look at attrition in the justice system, it's like an exponential decay curve, so that by the time you get to an actual, because the police may or may not investigate, the prosecution may or may not choose to press charges, then the jury may or may not convict, the judge may or may not sentence.
Right. It's a risk.
So by the time you get to an actual conviction and prison term, it's less than 1%. So, this nonsense about, well, why didn't she just go to the police? I mean, that's not the justice system we have.
No, not at all. Yeah, and you speak to that so beautifully in the book. You talk about that process. And one line that you said that really jumped out at me, you said, it's bad enough that our clients lost their childhood. It's unacceptable that they lose their adulthood too.
Yeah. Yeah. And yet, here are these people who went through it. And there were more who would have, who did get as far as at least making a police report. But we're blown off because, well, why did you go to that party? And what were you wearing? And, how many beers did you have? And so really, unless it's a Black stranger assaulting a blonde white kid, theoretically, sexual assault is a felony. And in practice, it's a crime of impunity.
Yeah. So you mentioned this piece about how true healing, it's not just an individual private undertaking that needs to make happen.
Right.
It's a social problem. Can you speak to that more of what you propose in the book?
If you look at the epidemiology of gender violence, when you have, 20% plus or minus of the population, female population, sexual assault survivor, maybe up to 5% of boys also, and similar statistics for sexual harassment, sexual domestic violence. And then when you get into the prevalence of sex trafficking, you can't talk about epidemic. These are endemic crimes. They're deeply part of the fabric of society. And you have similar data, whether you're talking about crimes of racial subordination or religious discrimination or any of the ways in which a subordinate group is kept in subordination. And so you get, the kinds of health statistics and statistics on police violence and so on when you're dealing with people of color and indigenous folks. And, holding one particularly notorious perpetrator accountable is a start when you have repeat offenders, like, cops who have this many Black notches on their belt. And you finally get one prosecuted for murder. Okay, that's a start. But this isn't a matter of a few bad apples.
Right.
This is a matter of crimes that are rationalized, excused, tolerated, and even celebrated. And whether you're talking about fraternal orders of police or college fraternities, there are groups in which people brag about this.
That's right.
And are proud of what they've done. And their unions or their alumni associations back them up. So this is a social problem, and a political problem, and we have to deal with it on that level.
This makes me think of the 3 teenage trafficking victims that you talk about.
Right.
And how it is a social problem, and how one of them wrote in that, was it that she wrote to the Boston Globe?
Yeah.
And she said, the real story is all of you who think it's acceptable to buy someone.
Yeah.
That somehow this is perpetuated, that there's a market for it. Otherwise, it wouldn't be happening.
Oh, there's a huge international market. I mean, it's right up there with guns and drugs as an international criminal trade. And, I'm old enough so that in my day, we used to have telephone books. People don't know what a telephone book is anymore.
Yeah.
But before we had the internet, you looked up somebody's phone number in the phone book. And if you wanted to order pizza, there were the yellow pages, and you'd look up pizza and for, a store in your neighborhood, and you'd order a pizza. So when I would talk about sex trafficking, I would say to folks, go get your yellow pages, look up pizza, see how thick, see how many pages of pizza you've got. Now look up escort services. Okay. And it was just as thick. Okay. You could buy a girl or a boy. And by the way, the average age of initiation into prostitution is 13. That means as many younger as older.
Right.
And the pimps know how to spot them. Or in some cases, they're pimped out by their daddies, or the pimp who says, call me daddy. But you can, of course, now you just look online and you can order up, takeout or a takeout person.
Mm-hmm. So in your second book, Trauma and Recovery, you talk about CPTSD, back then developmental trauma.
Yeah.
Right.
Yeah.
And so I'm wondering if you can share, how is that developed, or is there anything new in your third book that you've learned about that? What has time shown you? And I know you said more what's important is what stayed the same, but I'm just curious if anything has developed.
Well, I think as far as complex PTSD goes, and the way I conceptualized it was that it was a consequence of prolonged and repeated trauma. And so that it encompassed prisoners of war and battered women, and then, of course, abused kids. And of course, the earlier the onset, the longer the duration, and the more it forms or deforms the personality. I think really the main development in that regard has been finally the recognition of complex PTSD as a real diagnosis by the World Health Organization in the ICD-11, in the International Classifications of Diseases. And so most of the world now recognizes CPTSD as an entity. And I think that's important diagnostically and from the point of view of treatment. Diagnostically, because if you just focus on one or another of the multiple symptoms in complex PTSD, you're not going to see the big picture. And you're just going to, because it combines features of somatization disorder, dissociation disorders, anxiety disorders, depressive disorders, and personality disorders, you could focus on any one of those, or else you're doing polypharmacy, or you're trying to treat 5 different diagnoses, which is ridiculous. And you might miss the traumatic origin of it all, So I think that's a big advance. The United States now lags behind the rest of the world. The American Psychiatric still has not formally recognized complex PTSD, and their argument is an interesting one. What they've done is import some of the descriptive characteristics of complex PTSD into the official diagnosis of basic PTSD, but they don't make the distinction between a single impact trauma. Afterwards you're able to flee to safety, and prolonged repeated trauma, which basically means you're in a relationship of coercive control under the control of the perpetrator. And so again, the context falls away, and the treatment, you might be able to do a few sessions of EMDR for someone who's been in an auto accident and have a beautiful outcome. It's not going to work the same for, someone who's started being physically and sexually abused at age 6 and went on till puberty. So, and the quote unquote evidence-based treatment is mostly based on excluding people with complex PTSD because they're too complex.
Right, they're too complex. So we can't put them in a control group.
No, and you can't get rid of them in 6 sessions,
Right.
Or you can try, but it's
not gonna. Yeah.
But the argument in the APA was ultimately, well, there were 2 arguments as I understood them. A was it combines too many categories. So we can't have that. And so if the evidence doesn't fit the categories, we'll get rid of the evidence and stick with the categories. Now, people get very concrete about these categories, and then they get turf conscious. I mean, it's pathetic, but it's true. I mean, academia is no better than in that regard than the rest of the world, I'm afraid. And the other was, well, there hasn't been enough research. My argument to that was, well, there wasn't very much research when the DSM-3 recognized PTSD. But once the concept is recognized, then you can do the research.
There's funding, there's resources.
Yeah, then it's real. So, and the reason we recognized it was not because psychiatry suddenly became enlightened. It was really thanks to the Vietnam veterans against the war who came home and threw their medals over the White House fence and testified in public speakouts that, in their minds, they were still in Vietnam and they looked like they were fine, but they weren't fine. And that's really what did it. So again, unless you have a social movement that validates survivors, you're not going to get the powers that be to change how they think.
Right. I've so appreciated your expanding on, and I hope everyone will go get your book. It's so rich, and I'm going to have to read it again because there's so many things that I'm still thinking about and taking in. And, as a survivor, there's so many times that in my own life, I've sort of, I don't know, this is how I say it. Maybe this isn't accurate, but I've sort of had to gaslight myself in various ways.
Yep.
And so kind of untangling all of that, it's a complex process. And so many of your words in this book are validating, and they really have me thinking about how can we really band together and have more of this social movement that you talk about. It's so vital. It's so critical.
Right. And it's not only paying it forward, but it's when you band together with people trying to make a better world, it kind of restores your faith in humanity, Yeah. My mama used to say, activism is the antidote to despair. And I thought that was a good pearl.
Your mama, she's a wise woman. And that's a whole, I've read just a little bit. I know she was quite educated, and
she was a psychologist.
She was a psychologist and really contributed to your moving into this field. About your roots and where you came from and how you came really to this work. And I wonder if I could ask one more question.
Sure.
Do you have any more words that you would want listeners to know and take from this conversation? Anything important? Again, I hope they go and get your book. I hope that we can all read it several times, but is there anything else that you would want to leave us with?
Well, I just like always to say, find your support system. Don't try to do it alone. It's a big problem. It's a big, big problem. You can't really take it on alone, but, so find your buddies, find your posse, find your support group. Yeah.
Wise words. Thank you so much, Judith. I really appreciate, again, your time and so much heartfulness that you put into your work, and that it will continue to affect the field for years and generations to come. It's been such a gift, what you've put out into the world, and I hope we can have you back sometime, have more of those conversations.
Thank you for having me.
Absolutely.
Take care.
Thanks so much for joining us for today's episode. To find more about our guest and their work, check the show notes or visit us at narmtraining.com/transformingtrauma. Are you working with clients or populations dealing with the effects of adverse childhood experiences and complex trauma? If so, we invite you to consider joining us to become trained in the neuroaffective relational model in support of trauma-informed care. We are excited to offer psychoeducational and clinical trainings for a variety of mental health professionals. For more information on these NARM trainings and to apply, please visit www.narmtraining.com/schedule. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Tori Essex for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community, connection with you, and changing the world by transforming trauma.